What's up, good people? Welcome back to my channel, and in this specific video I'm talking about the risk factors of glaucoma, that who amongst us is at a risk of glaucoma and needs to be checked for that or screened for that. Number one, age. Age is a big factor. Age is a huge factor. 40 plus age could be a risk factor for glaucoma. Okay. Family history. If you have a positive family history of any type of glaucoma, please be very, 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 very vigilant about glaucoma in your case. You have to know your pressure in the eye. You have to get annual or 2-yearly eye exams. Okay. African Americans or Africans, Hispanics, and even Asians are at a risk of glaucoma. High pressure in your eyeball during the screening is another factor that determines, or that is a risk factor for glaucoma. History of eye injury. That's why some people who got, for example, boxing injury in one eye could be at a risk of unilateral glaucoma. So don't be surprised if you have high pressure in just one eye. It could be because you had a big trauma to that specific eye maybe 10 years ago, and now you see the pileup of that problem as a high pressure. Okay, long-term steroid use is also another factor. It's a risk factor, so that could put you at a risk. Many asthma patients, COPD patients, and other systemic endocrinological problems, and many other problems like lupus and arthritis, many patients are on steroids for certain conditions. But the problem is steroids can increase the pressure in your eyes. So please be very, very vigilant. Thin cornea. Cornea is the front layer of your eye. After your tear film comes your cornea. And that cornea in some people is thin just by birth. It's not their fault. It's just their genetics most likely. Okay? And thin optic nerve is another risk factor. That's why we look at the optic nerve in every comprehensive eye exam. Diabetes, unfortunately, is another risk factor. I have a ton of videos on diabetes. That's one of my areas of interest. So check them out, please, okay? Migraine. Migraine is also one of the risk factors for glaucoma. Isn't that crazy? High blood pressure is another risk factor for glaucoma. So these are the risk factors for glaucoma. These things tell us, these are the main ones. The list could keep going on based on the researches and the advancements in the science. But this is a precise and most common list that we share, that yes, this kind of patient could be at a risk. 40 plus, African American, Hispanic, Asian, high blood pressure, diabetes, migraine, steroids, thin cornea, thin optic nerve. So these are the things that tell us that I need to be addressing my patient very, very cautiously and telling them that, yeah, you are at a risk of glaucoma. I need to see you every 2 years and check your pressure in the eye and check your every component inside the eye to make sure you don't get glaucoma. Okay, thank you so much. Have a great day. Bye-bye.